Hello viewers, welcome to Medgate Today TV Digital, and today we are at Kidney Warrior Foundation Conclave 2026, and we have Dr. Urmila ma'am with us who will tell us the motive, the vision and mission of setting up this kind of foundation and leading for the patient safety and for the healthcare fraternity. Hello ma'am, could you please introduce yourself?
Hello, I'm Dr. Urmila. I'm a Kidney Warrior Foundation volunteer for many years and also a consulting nephrologist, head at Amrita Hospitals. I had been the privilege of starting the Women in Nephrology India about a few years ago, and this is a major organization taking care of women nephrologists.
Okay, and ma'am, what is the vision of this foundation? How the story has started?
See, I think many of you should know this foundation, the chairperson of this foundation herself is a kidney donor.
Okay.
And when her family got through this problem of kidney disease, she herself realized the pain, the agony that the patient not only goes through at a very young age, but the whole family gets
Yes.
involved with it.
Yes.
And I think most of you should know treatment of kidney disease is not an easy task. It is a disease which doesn't leave you alone. It is chronically there for years together, has a tremendous financial burden for the family.
Yeah.
And then, if you know, Madam also, her son had gone through 2 transplants.
Oh my God.
And then we have members of the Kidney Warrior Foundation who are patients who are either on dialysis or have gone through transplants. So the motive of this organization is to not the patients go through what they have gone through
Okay.
and be with them, support them at the hour of their need. उनको बोलना है कि आप अकेले नहीं हो.
Yes, there is someone who can
Yes.
take care of yourself.
And this is what is the organization is doing. It's a voluntary organization. It has got no support from the government, nothing. So we talk to the private partners, to corporates, get their fundings, help the patients with some money, help them to go and meet doctors. I'm aware that sometimes when during COVID,
Yeah.
when the dialysis was not happening,
Yeah.
blood transfusion was required, these organizations stepped up to offer dialysis and
Wow.
कहाँ करवा सकते हो वहाँ जाओ, ब्लड की जरूरत है दे दो ये सब.
Very
Now,
nice.
what is the motive of this conclave? See, they have done meetings in Bangalore, Bombay. Now, doing it in the national capital has its own meaning.
Yes.
It is the place of power, and हम लोग सब कर रहे हैं. We as an individual are helping the patients, but governments को इसमें
Yes,
involve करना है. So
exactly.
this is the first time we had the privilege of getting the Minister of State for
Wow.
Health, Amrita Patel, so that she understands and she is part of this conversation.
And she understands the
What is the needs?
Yes, exactly. And it has completed 50 years.
50 years of nephrology has been completed. We started nephrology in 1971
Oh.
when the center I trained, where there was dialysis,
Okay.
first dialysis and the first transplant.
Great.
So 21, 22 में करने वाले थे, कोविड होके नहीं कर पाए.
Yes.
And दिल्ली में मुश्किल हो रहा था, तो अभी दिल्ली में we started and we thought कि क्यों ना ministers को बुलाएं. This is
Exactly.
more opportune in a sense. Last October, World Health Assembly and United Nations ने किडनी डिजीज को एक नॉन कम्युनिकेबल डिजीज का दर्जा दिया है, जो कि डायबिटीज के लिए है, हाइपरटेंशन के लिए है,
Yes.
हार्ट के लिए है, मेंटल हेल्थ के लिए है, कैंसर के लिए है.
Okay.
सो वी वांट द मिनिस्टर कि आपके भी नेशनल हेल्थ मिशन है,
Yes.
उसमें आप हाइपरटेंशन एंड डायबिटीज पेशेंट्स का स्क्रीन करते हो,
exactly.
उनको देखते हो. अगर उनको हाइपरटेंशन या डायबिटीज है, उनको आप एक स्टेप और ले जाइए किडनी में.
Yes, exactly.
So this is actually, if you understand, this is the motive. Not only take care of the patients, help them understand nephrology, and also get this conversation to the corridors of power in India.
Exactly. So that most of the people
Can
will-
be helped.
Yes.
And अगर गवर्नमेंट की सपोर्ट आती है ना, गवर्नमेंट बहुत कुछ कर रही है.
Yes.
डायलिसिस कर रहे हैं, नेशनल हेल्थ कर रहे हैं, बहुत कुछ. अभी किडनी के लिए, ट्रांसप्लांट्स के लिए भी पैसे दे रहे हैं,
Yeah.
पेरिटोनियल डायलिसिस के लिए भी. बट ये ना, आप जब सब चिड़िया चुग गई खेत, तब 50 लाख खर्च कर रहे हैं.
Yeah. It's a hand-on-hand collaboration where the government can be on board along with the patients and the healthcare fraternity who are leading and who are there to take care of themselves. So it is such a good foundation who are working for the patients who are going through a lot, and they want them to know that they are not alone, and the foundation is here, the doctors are here, and especially they are working like a family to them. Thank you so much, ma'am, for telling us more about the foundation. Looking forward in the future.